Are you thinking about starting a ketogenic diet or ketogenic therapy, but you heard there are lots of contraindications to worry about? It can be confusing to know what truly is or is not a contraindication. And, as more and more people are finding ketogenic therapy helpful for treating or even reversing metabolic diseases and mental disorders such as type 2 diabetes, fatty liver, or bipolar disorder and severe depression, it becomes important to really make this crystal clear. So, what about the contraindications? Who shouldn't try a ketogenic diet? Well, let's talk about it. So first, let's differentiate between absolute contraindications and relative contraindications. Often, a publication or discussion may not differentiate between the two, but it's crucial to really know more about them. As the terms imply, an absolute contraindication means someone absolutely should not try a ketogenic diet. And fortunately, these are very rare. Whereas a relative contraindication is less strict. And to be honest, I don't even really like the term relative contraindication. In my mind, it means that more caution is needed and someone should be working very closely with an experienced clinician. So it's more like a contraindication in untrained hands and a potential opportunity in trained hands, but we'll get to that. But first, let's get into the absolute contraindications, which fortunately are rare. And they include these rare inborn errors of fat metabolism, such as carnitine palmitoyl transferase deficiency, or very long-chain acyl-CoA dehydrogenase deficiency, primary carnitine deficiency, porphyria, and some others. Never heard of them? Don't worry, most people haven't. They are very serious conditions, but also, fortunately, very rare. And let's be honest, they're not subtle. So kids born with these conditions almost always have signs at a young age, and it's not something very likely to present later in life. Other absolute contraindications include acute severe illnesses. Notice the word acute, such as acute liver failure or acute pancreatitis. Now, what's interesting is that the chronic form can be beneficial with ketogenic therapy. So chronic liver disease from fatty liver can benefit, or chronic pancreatitis from high triglycerides could benefit. So the chronic conditions are quote unquote relative contraindications, which I will discuss, while the acute condition is more likely an absolute contraindication. So that's an important differentiation. Now, you might also see pregnancy and breastfeeding listed as absolute contraindications. And this is controversial because sometimes they're also listed as relative. And the same is for someone taking SGLT2 inhibitor medication like Farxiga or Jardiance. There's an increased risk for ketoacidosis with all of these, pregnancy, breastfeeding, and taking SGLT2s. But many experienced clinicians are actually comfortable using ketogenic therapy in select patients in those circumstances. So you can see how the level of comfort and expertise of the treating clinician is very important. Now, other relative contraindications you may commonly see are type 1 and type 2 diabetes and heart disease. And again, some people are surprised to see that listed as a contraindication because ketogenic therapy can be incredibly beneficial for someone with type 1 diabetes, type 2 diabetes, or someone with heart disease. But certainly if someone's taking medication to lower their blood sugar, lower their blood pressure, then it's imperative to work closely with an experienced clinician because ketogenic therapy can lower blood sugar and lower blood pressure, thus necessitating medication dose adjustments. And thus it's often listed as a relative contraindication, but really, it can be a powerful treatment in the right hands. And one we're curious about here at Metabolic Mind is when we see serious mental illness listed as a contraindication. Again, to me, this means that it should be undertaken with an experienced clinician or clinical team. And that's important because, for instance, someone with bipolar disorder, being in ketosis could potentially trigger a manic episode. And we have a whole video about that. Or for someone with depression, the keto initiation phase may make them feel worse before they feel better. And many psychiatric medications may become potentiated, meaning their effect increases, so the dose may need adjusting. These are what makes psychiatric conditions a, quote, relative contraindication, which again means more serious monitoring is required. And what about high cholesterol? You may see that listed as a relative contraindication, and sometimes even familial hypercholesterolemia is an absolute contraindication. Now, as a cardiologist, this one gets me riled up every time I see it. This is purely based on opinion, not data. And the data show that for most people using a ketogenic diet for weight loss or to treat type 2 diabetes, LDL cholesterol does not increase. But even for those for whom it does increase, it's worthwhile to investigate if that translates to an overall increased cardiac risk or not. So again, as long as someone is working with an experienced clinician willing to see the whole picture, it's not a true contraindication. And the last one I'll mention is anorexia. On the surface, it could make sense. if you think a keto diet is a weight loss diet or a restrictive diet. But when you see it as a therapeutic metabolic and brain energy intervention, it can actually be therapeutic. And that is what Dr. Guido Frank is studying right now at UCSD, with pilot studies showing not only safety, but an association with improvement in anorexia and coexisting depression. Future studies will explore this further, but again, is it a contraindication or a situation that requires careful monitoring from an experienced clinician? And I don't mean for this to come across as accusatory for those who list these circumstances as contraindications. I get it. Their primary concern is protecting people from trying something on their own which can harm them. That makes complete sense. Or even an experienced clinician trying ketogenic therapy in a dangerous circumstance. But just be aware that there are rare absolute contraindications, and the relative contraindications really mean don't try it alone and don't try it with an experienced clinician, but rather work with a clinician experienced with the safe use of ketogenic therapy. And you can find many of these clinicians in a number of directories that we have listed at metabolicmind.org. I hope this was helpful for you to better understand the so-called contraindications to a ketogenic diet and understand how to, which ones are absolute, relative, and how to work around them if needed. So let us know your thoughts, and please like and subscribe if this was helpful. And thank you for watching. I'm Dr. Bret Scher. We will see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.